Thank you so much for joining Advocates for Ohio's Future today for a webinar on the changes to the Medicaid Spend Down program. We're going to take a close look at this complex transition. If you've never been on a webinar with Advocates for Ohio's Future before, you should know that we are a statewide coalition of over 475 organizations and thousands of individual advocates like you who focus on making Ohio a great place for all Ohioans to live and work. That means that we look a lot at policies that would help Ohioans participate in the economy, that would help them be healthy and safe in their communities, and also help them afford the basics. We hope that you will continue to advocate and listen with us after this webinar. You'll be receiving a follow-up email that has all of the details and follow-up from the webinar, and then we will include you on our email list going forward, where we'll have, from time to time, email alerts, invitations to other webinars, and new resources that help you advocate for policy in Ohio. You're welcome to unsubscribe at any time. There's a link in every email from us. Today, we'll be hearing from 4 presenters and then from 5 experts during our question and answer session to talk about different aspects of the transition from spend down. We'll be hearing first from Jeannie Carroll, who's the Assistant Director of the Ohio Job and Family Services Directors Association. We'll also hear from Beth Kowalczyk, the Chief Policy Officer of the Ohio Association of Area Agencies on Aging. We'll hear a presentation from Teresa Lample, who's the Associate Director of the Ohio Council of Behavioral Health and Family Services Providers. We'll also hear a presentation from Zach Reet, the Director of Work Support Initiatives at the Ohio Association of Food Banks. And finally, Steve Wagner, Executive Director of the Universal Healthcare Action Network, or UCAN Ohio, will be joining us for the question and answer session. There's a lot of detail to these programs today, and so we will be providing at the end of this webinar an additional opportunity to share your questions with our presenters, and we'll talk more about that as we get to the end of the webinar. I'd just like to mention before we begin that this group of advocates have been hugely instrumental in communicating with members of the administration over the complex details of this transition. And they've really been able to make an impact on the process and help us to know the details that we know today, even as more questions are coming out. So I just wanted to start by thanking you all for the diligence that you've had through this process in trying to ensure that this system works best for Ohioans and the people that it's trying to serve. Without further ado, I'll turn our presentation over to Jeannie Carroll. Jeannie, are you ready?
Yep, ready to go.
All right.
Good morning, everybody. Good morning, everybody, and I'm very happy to be able to speak with you today. And I'm going to talk about, just give an overview of why we're doing this and some of the timelines that are coming up for these changes. So just in order to get some background so we're all on the same playing field, Section 209 of the Social Security Act requires states to provide Medicaid to anyone who receives SSI, and Section 209B allowed states to choose to be more restrictive in their income and resource methodologies. Ohio chose to be more restrictive both in income and in resources. States that chose to be more restrictive are required to allow individuals to spend down to their more restrictive income limits. So in Ohio, what this means is that every month a person who has been found eligible for spend down Medicaid had to incur medical expenses or pay the amount of their spend downs in order to receive their Medicaid. So, as you all are aware, Ohio is moving away from this 209B option to the 1634 option, which is allowed in the Social Security Act. And in this option, it allows states to accept the Social Security Administration's decision for SSI, which what really means to the work that we do is that we no longer have to determine anybody to be disabled. All of those, you've probably heard stories about the DDU disability determinations that counties had to do in the past. They will no longer have to do those. They will accept SSI's decision that this person is disabled and therefore eligible for Medicaid. And in fact, SSI beneficiaries will automatically be enrolled in Medicaid via a nightly data exchange. So that means there's no separate application for Medicaid that is needed. People that are found eligible for SSI automatically will be eligible for Medicaid. And then individuals with income less than 75% of the federal poverty level will no longer need to spend down to 64% of the federal poverty level to obtain full Medicaid coverage. So that eliminates that spend down program that we used to have, but it also ups the federal poverty level so that some of the folks, not all, but some of the folks that were on spend down before will now be able to receive full Medicaid coverage. So timelines, when are we talking about this happening? The state had changed them once or twice, but now it looks like we will be going live for Medicaid and with the ABD changes on August 1st, 2016, so a little over a month away. This policy change from 209B to 1634 is happening at the exact same time that we're changing from our old CRIS-E eligibility computer system to the new Ohio benefit systems. These are two very, very large changes that are happening at the same time. We're having both a policy change and a systems change happening over on August 1. So the conversion of all of those millions of files of CRIS-E cases where all the ABD and long-term care and waiver cases are stored currently, that's going to happen. Those files that happen starting at 5 p.m. on Thursday, July 28th. The CRIS-E system will close in order to prepare for the conversion of all those cases. The e-gateway system will also be down. The self-service portal will remain open for applicants to submit new applications. At this point, no new applications will be accepted by CRIS-E, and all of the current and pending ABD applications are transferred over to Ohio Benefits. This is as I said, a transfer of millions of files. It will take all of 4 nights and 3 days to complete. We're talking about 3 large systems that have to interface: the CRIS-E system, the Ohio Benefits system, and the MIT system, where all the provider information is kept. All of those systems will be working together over that long weekend. Ohio Benefits will open up on Monday, August 1st at 6 a.m., and from that time forward, all Medicaid cases will be processed in Ohio Benefits system. There'll be no more cases in the Medicaid cases in CRIS-E. Of course, SNAP and TANF will continue in CRIS-E until next year, at which point they'll be transferred over to Ohio Benefits as well. But all Medicaid cases will be moved over at that point. So the state has asked for several waivers of policy. They've not received, from what I have heard as of yesterday anyway, they've not received approval on some of these waivers, but they do believe they will happen. And so I'll go through those here in a minute. So people are asking, how will spend-down cases be converted? So one of the waivers the state has asked for is that any individual who met their spend-down in at least 1 month between August 1, 2015 and July 31st, 2016 will be converted over to the new system and will have full Medicaid coverage after the conversion. That means these people will no longer have to meet their spend down, and they will be put on fee-for-service during that time period. That's the first waiver that they've asked for. And those folks will remain eligible for full Medicaid until their next renewal or until there is a major change to their case. The major change for the case has not been defined yet by the state, but they are asking for it to be something that would have a big impact to the case. If there's a large income change, if a person moves into the household or leaves the household, those are the kinds of things they're looking at. Medicaid has also requested a waiver of all ABD renewals until January of 2017. That means that if a person is scheduled for a renewal between August 1 of 2016 and January 1 of 2017, their renewal will be delayed. At the time of their renewal, the converted spend-down cases will have their eligibility for Medicaid determined based on the new 1634 eligibility requirements. So that would be the point when those folks might find out that they're no longer eligible for Medicaid. Some might have some eligibility that for some reason didn't get picked up in conversion, but I think that a lot of those folks will find out at that point that they are no longer eligible for Medicaid. Just want to give you an example of what this delay in the renewal means. For example, if a spend-down case has a renewal date of October 1 of 2016, they would not have to do their renewal until October 1 of 2017. So they have a year delay there unless there's a major change. However, if someone had a renewal date of January of 2017, their renewal will happen on January of 2017 because the delay for the renewals only is between August and January. So what are these populations we're talking about? Based on information from the old CRISI system, approximately 34,000 individuals met their spend down at least once in the past year and will be converted to full Medicaid until their next renewal. Additionally, there's some good news for folks that the 11,804 people who currently are on SSI but for some reason or another never applied for Medicaid. Those folks will automatically be enrolled over into Medicaid. There's also a little bit of good news for the 3,943 single adults who do not otherwise qualify for ABD or Medicare but have monthly incomes below $1,367. They will be eligible under the new expansion group, and therefore they will no longer have a spend down and will continue on Medicaid as long as they meet the guidelines of the expansion group. There's also 5,527 individuals with severe and persistent mental illness that will now qualify for the SRS program, and we will be talking about that in more detail here in a few minutes. So, second. Some of these folks will continue over. There'll be a number of folks that will not be eligible, and they will no longer be receiving Medicaid. Some may qualify for Medicare premium assistance, some for Medicare only. Some will be eligible under the the Marketplace Exchange, and some will need to seek private health insurance. This is the bad news for a group of people that currently receive spend down Medicaid, but will no longer be eligible. Those people will be disqualified for Medicaid and most likely will find that out at their next renewal when they have their renewal with the county. Long-term care, income eligibility criteria for individuals needing Medicaid long-term care services has not changed as a result of the Medicaid redesign, and individuals with income up to $2,199 will qualify as they do today. However, individuals with income over the limit will need to establish a qualified income trust or QIT, or sometimes known as a Miller Trust, to qualify for Medicaid. And I believe Beth Kowalczyk will be talking about that in detail here in a minute as well. This includes all individuals who need long-term care residing in a nursing facility or intermediate care facility for individuals with intellectual disabilities, or receive home and community-based services on waiver programs like Passport, Assisted Living, Ohio Home Care, Individual Options, and My Care Ohio. So that's the overview, and I think we're ready for the next speaker.
Okay, well, that's me, Beth Kowalczyk. Thank you, Jeannie, and hello, everyone. I'm going to give you a few more details about the long-term care options and the impact on those who are Medicare beneficiaries. And I just want to reiterate, as Gail said in the introduction to this presentation, this webinar is intended to give you a broad overview of the changes and as we understand them as of today. Many individuals and organizations have been working on this issue for over a year to understand the proposed changes and advocate for consumers who are going to be impacted. And as we ask questions, we learn more, and the state has to come up with answers. And so I don't think all the answers to our questions have been provided, and I think there's probably some we haven't thought of yet, but just wanted to let you know that this is a broad overview. We don't have answers to all the details at this point, and things, as Jeannie has indicated, as of today, we know what we know, and they can change. And as Gail said, if people have questions, if there are things we can't answer, we can possibly take them back to the state and get answers and potentially distribute them, post them on the website or something like that. So, qualified income trusts. As Jeannie mentioned, some individuals who are receiving long-term services and supports are going to be impacted by these changes to spend down and move to 1634. And while income eligibility requirements will not change, how the individuals can become and remain eligible will change. And as Jeannie indicated, basically the people affected are those receiving long-term care services, either they're home and community-based waivers or they are in a facility, nursing facility or ICF. They will no longer be able to deduct the cost of care from their income to become eligible for these services. And so while people don't technically call that a spend down, it's the same idea. Individuals with income above the special income limit of $21.99 a month currently now can deduct the cost of care from their income to get below that $21.99. With these changes, they will not be able to do that. Instead, income in excess of $21.99 a month will need to be deposited into a qualified income trust. But individuals with income below $21.99 a month won't have to do anything. They will be fine, and this process won't impact them. But for those it does, and who will need a trust, they'll need to have the trust set up and income deposited as of the month of redetermination, as you heard from Jeannie's timeline. For new applicants, as of August 1st, eligibility will begin when the income is deposited into the trust if it is after the application date. There will be no retroactivity for eligibility, so you have to have your income eligibility all squared away before you are determined eligible, and that will be your eligibility date. It's our understanding at this point that this will impact an estimated 8,000 people. So what is a qualified income trust? It is a special legal arrangement to disregard an individual's income over certain thresholds, and in this case, $21.99 a month. It is basically a bank account, but it has restrictions imposed. It's called an irrevocable trust, which means once it's established, it's permanent. And it has restrictions on the use of the income that's deposited into the trust. The income must only be used for bank fees for trust administration, medical expenses, patient liability, and monthly personal or maintenance needs allowances. The income is not available for any other purpose. Also, the state is the ultimate beneficiary upon the death of the individual. The state is entitled to any remaining funds in an amount equal to the total amount of the medical assistance paid on behalf of the individual by the state. Some other things to note: the income in the trust is not counted as a resource in the eligibility determination. However, the income is considered when calculating patient liability, so nothing is supposed to change with patient liability. The money is just in the trust, and to pay the patient liability, you have to pay it out of the trust. Individuals must have verification that the excess income is being deposited monthly into the account, and the county departments of Job and Family Services will need to monitor that. Okay, so notices have been sent to individuals that the state has identified as needing a qualified income trust. They have identified the 8,000 individuals and have sent out notices. They have also, the state has contracted with automated health systems to assist people in entering into these trust arrangements. Automated Health Systems is the vendor who also runs the Medicaid hotline. They have an attorney that they've contracted with on staff to help provide answers to legal questions. And they have currently been contacting individuals and presenting them with trust documents that have been developed by the state. They have an 800 number, an email address, and can be contacted if an individual believes they need a qualified income trust. And they are supposed to be available not only now during this transition period, but afterwards on an ongoing basis to assist consumers to set up the qualified income trust. And I also want to point out the Medicaid website does have some information, frequently asked questions, the template that the state is using for the trust, and a video and a sample notice. It is important to note that individuals can do their own trust documents. They don't need to use the state's template, but it does have to meet the requirements for the qualified income trust. And they can consult their own attorney, so they don't need to use automated health systems to help them set this up. I just wanted to point out some issues that we've heard regarding identification of the people that may need a qualified income trust. One thing, the state mistakenly sent notices to people who are not subject to this requirement because they are participants in the Medicaid buy-in for Workers with Disabilities program, and that program is not impacted by this at all. People should not have to do anything, have any changes to their eligibility as a result of this new transition. So it's our understanding the individuals received another notice from the state informing them of the mistake and telling them to disregard the first notice, but as you can imagine, it had caused a little bit of panic for people. And it does provide an example of some of the challenges in contacting people and identifying the correct people that might need this trust. We have also heard that the people identified by the state may not need the trust because of their income level. And so just last week we learned that Automated Health Systems will be conducting an income review before they contact people any further. So it is important that people are really aware of this and not entering into these trusts without understanding what it is and whether they really need it. Another issue is that advocates have expressed concerns about forcing people into guardianships if they don't have anyone easily identifiable to set up the trust or be the trustee. This is problematic on many levels, especially because a guardianship is not always needed and can result in individuals having to relinquish their rights. So there's so much confusion about whether you need a QIT or not. And one thing that I think people need to be aware of is that the rules are still pending. The plan is to implement August 1st, but if people go apply today and are told they need a QIT today in order to be eligible, that's incorrect. August 1st, if people apply and have not had services before that, then they will need a QIT. But there's a lot of confusion about that issue. Okay, so since there's a lot of confusion, we wanted to give you a list of resources that you could refer people to if they needed help, because not everybody can afford their own attorney. And we will make this list available in a separate page or document or something, and we'll add to it if we become aware of other areas where people can go to for help. But we have, and it is important to also stress that people being approached to do a qualified income trust, if all of the things that the state has asked for from the feds is approved, then there is some time that they have before they need to enter into the trust. And again, so it's really important for people to make sure they actually need a QIT before they sign these trust documents. So I just wanted to mention Pro Seniors has a hotline for seniors age 60 and older, and they can set up appointments for people who call the hotline and appointments with attorneys and can help them review their situation and provide them with some advice. Disability Rights Ohio has staff attorneys that can provide guidance, especially if there's a question regarding guardianship. And then also Legal Aid is available to provide free legal assistance in civil cases for low-income Ohioans. And the Law Ohio number will direct you to your legal aid that covers your area. There are also elder law attorneys throughout the state. We've worked with a lot of them on this issue. And the best way probably to identify them is to go through your local bar association and see if they can provide referrals for low-cost or pro bono assistance. And legal aid programs can do that as well. So finally, the other population that I'm going to talk about is those who are currently receiving both Medicare and full Medicaid and are not receiving long-term services and supports. They don't have waivers, they're not in a nursing facility or anything, they're just out in the community. If these individuals have income that is greater than 75% of the federal poverty level, the $743 a month, they will no longer be eligible for Medicaid using a spend down. They will also not be eligible for coverage under the Medicaid expansion category, Group 8, as Jeannie mentioned, because individuals who are on Medicare are not eligible for that coverage. So the state estimates about 15,000 individuals fall into this category. Any of these individuals who have income above $743 a month, the 75% FPL, but is below the $1,337 a month, will be eligible for some type of Medicare premium assistance. Depending on their income level, they may be able to at least have Medicare premiums covered, or at most have premiums, deductibles, and copayments covered as well. The state estimates about 3,000 individuals will qualify for these programs and will automatically enroll them. The remaining 12,000 will not be eligible for Medicaid or any type of premium assistance, but will still be enrolled in Medicare. So it's important to note that Medicare doesn't cover all of the things that Medicaid covers. It doesn't cover dental, vision, many behavioral health services, and individuals on Medicare are subject to premiums, copays, and deductibles. So this will be challenging for them. As was stated, you can post questions in the chat box, and we'll respond to them at the end of this presentation. So I am going to conclude and turn it over to Teresa. Thank you very much.
Thanks, Beth, and thank you everyone for being here. we're going to switch gears to another specialized population group and talk about the Specialized Recovery Services Program. As Beth just mentioned in her last slide, she talked about the coordination between Medicare and Medicaid, and one of the things that was recognized by the state as they were preparing to make this transition away from spend down and to having a single disability determination process was that there are a number of people in the spend down program who have income slightly above the 75% eligibility requirement, who would no longer qualify for Medicaid, and they have Medicare. So in looking at the benefit, there was broad recognition that while Medicare provides good coverage for physical health care services, it does not provide a very robust benefit for people who need mental health or substance use treatment. So the Specialized Recovery Services Program was developed to essentially fill the gap. And the other thing to make sure folks understand is that people with a mental illness by itself who are not in an institutional setting or not on another waiver do not qualify for the Qualified Income Trust. We've gotten that question quite a bit. So this is really people who are living in the community. They have a mental health condition or a substance use condition, and they need treatment, and Ohio's Medicaid program provides the comprehensive array of services that help support them in the community. I would point out, though, that this program is considered a home and community-based services program, but it is different from the other programs that are currently operated in Ohio. If you think about the Passport program, the home care waiver, the assisted living waivers, any of the waivers in the developmental disability system. This program actually is intended to create a new Medicaid eligibility category. In Medicaid speak, that means it's being filed under what they call a 1915I state plan amendment. It creates specific eligibility criteria that must be met in order for the individual to access their Medicaid coverage, or in this case, to maintain their Medicaid coverage. It requires under the program that there's conflict-free case management, which we'll talk about in a little more detail, and it requires that the individual's home be evaluated to make sure that it is not an institutional setting or an institutional-like setting, that it really is a place that they live that meets that is their own home, and that they have control over decision-making around their lives. So once with the Specialized Recovery Services Program, or SRS program as it's referred to, once the person's determined eligible, they will have access to the full Medicaid benefit, which is a really important piece. So again, this is not just adding new services, but it's access to their Medicaid benefit. Initially, as was talked about by both Jeannie and Beth, there will be this transition period, assuming it's approved by the federal government, where people will be enrolled into full benefit Medicaid in August, and they will maintain that until their next renewal through the Medicaid program or their Medicaid redetermination date. So for this, they'll have, when they are enrolled in that program, by that timeline, then they will have full Medicaid coverage for all of their physical health care services and other services covered by Medicaid, and they'll have access to 3 new Medicaid covered services offered under the SRS program. And those 3 services are recovery management, individualized placement and support employment, and peer support, which we'll talk about in a moment. So I want to spend a little time and talk about the eligibility, because I think this is the most important thing, and our concern around this program has been making sure that as many people as possible who have a mental health condition today are able to maintain their Medicaid coverage. Because this is about Medicaid eligibility and not just accessing the 3 new services, it really becomes critical to understand that the next 2 slides and the elements I'm going to talk about really speak to what they have to meet, and they have to meet all of these requirements in order to qualify. So the first is not surprising that there is an income test. So they have to have income between $743 and $21.99. They have to be they have to be 21 or older. The individual has to have a disability determination. So that can either be through the Social Security Administration or Medicare. The individual has to have a qualifying mental illness, and there is a fairly expansive list of illnesses that are considered today. And while this program does not specifically apply to individuals with substance use disorders, if the individual has a substance use disorder along with a qualifying mental health condition, then the person should be considered for eligibility for this program. The individual also has to have functional impairments, meaning that they need assistance with daily living, and the way that this is being evaluated is using an assessment tool called the Adult Strengths and Needs Survey, or ANSA, and that's going to look at several factors. It's going to look at their mental health needs and or the risk behaviors that they experience, as well as having severe impairments in at least one area of living. So there has to be some level of serious functional impairment that requires ongoing assistance. person has to have a history of mental health service utilization. And that has currently been defined as over the course of their lifetime that they've had at least one inpatient admission for a psychiatric hospitalization, 2 or more visits to an emergency department related to a psychiatric condition, have been released from a correctional facility where they received inpatient or outpatient treatment for mental health conditions while they were incarcerated, or have a history of receiving intensive outpatient treatment in the community for more than 90 days. And then continuing on with the things that are required in terms of eligibility, the individual will have to agree to accept this new recovery management service. In doing this, the individual has to agree to have a new case manager who will be a recovery manager, and that person will be different than any of the other case managers that they currently have. And this is how the state is meeting that requirement that I spoke of earlier around having conflict-free case management. So this individual will be independent of any of the other service providers that they're already involved with. The person then has to agree to participate in the assessment, the development of a new person-centered care plan that will be used for purposes of the SRS program enrollment, as well as then the ongoing maintenance of that person-centered plan. And then finally, in terms of eligibility, the person has to live in a home or community setting that is not a nursing home, it's not an ICF IDD, or a setting that's institutional-like. And institutional-like is where we also start to look at things like there will be a close scrutiny of things like group homes or situations where you have congregate living. Their home setting will be evaluated by the recovery manager, and there is additional scrutiny around residences that are not owned by the individual or their family, but are actually owned by another service provider. So in this case, if an individual is living in an apartment where they have their own lease or they're living with a family member, they are presumed to generally be living in a home and community-based setting. Where this becomes a little trickier is if you have someone who needs some level of support in their home, in living in the community, and they may be living in an adult group home or an adult care facility. That is where there may be additional scrutiny. If they are in a house with roommates, there may be additional scrutiny in terms of understanding how that looks and what they're looking for. What this is really about is there has been changes in federal regulation trying to promote independence and choice for all persons with disabilities, and that's a really good thing. So it's really looking at making sure that the individual has had a choice in where they are living, that there are protections for their privacy, that they have the opportunity to have, if it's a congregate setting or a group home, that they can lock their bedroom door, that they can have privacy, that they have personal control of their living environment. They can decorate their room or the living room to their own preferences. That they have access to their own foods or unlimited visitors or visitation, is not controlled by the owner or others in the house, and that they have choice of roommates. So these are things that many of us would think of as being very, reasonable in terms of allowing people to make their own decisions in terms of where they live. The challenge will be in looking at this because this is also about Medicaid eligibility and maintaining their Medicaid coverage, is what happens if the person is living somewhere and maybe they actually like where they live, but it doesn't then meet this requirement. Does that then result in the person no longer being able to manage their Medicaid or have their Medicaid coverage? And so this is an area that we still have a lot of unknowns, and we're working through some issues trying to help us understand what the options are in terms of making sure that people can choose where they live and also have the best option of maintaining their Medicaid coverage. And then the other thing just to point out here, the last bullet on this slide, is that individuals cannot be receiving other home and community-based waivers and also be enrolled in the SRS program. So if they're covered under Passport or assisted living or a developmental disabilities waiver, they would not be eligible for the Specialized Recovery Services program. So now we're going to kind of make the assumption the person has gone through the process. The SRS eligibility review has been completed by the recovery manager, and they've been determined eligible. The other step I want to make sure I mention is that in addition to doing the eligibility for the program review, the individual will also still be required to complete a financial eligibility review with the County Department of Job and Family Services to confirm that they are financially eligible, even though the recovery manager may say, yes, they fall between the income requirements of $473 and $21.99. There has to be that independent determination of the financial eligibility through the County Job and Family Services office. So once they're eligible, then they're eligible for all of the Medicaid services as well as these three new services. And we talked about recovery management a bit, in that this service that all persons enrolled in the program will be expected and required to receive. And this is really a care coordination service. It is helping the person with gaining access to services, medical services, social services, as well as other services that they may need. It includes the face-to-face evaluation, it's the person-centered care planning, monitoring and updating, and it's the facilitation of community transitions from institutional settings. IPSSE, or as we refer to it as supported employment, is an evidence-based practice that's specifically intended to work with people with serious and persistent mental illness and helping them gaining the skills that they need to integrate into competitive employment. It's a model that focuses on employment as being integral to recovery and not an end goal of treatment. And right now there are currently 19 behavioral health provider organizations who are currently offering that service. And the third service that will be available is peer support, which is a really important service that allows people to work with others who have recovered or are farther along in their recovery from mental illness, and who use their lived experience to help people on their own recovery journey. And the Department of Mental Health and Addiction Services is currently developing a new peer certification process. That process, the rule was overseeing that was just approved and becomes effective July the 1st. And they are working through the process now of helping individuals who have lived experience and want to provide peer support services for others who may be earlier in their recovery journey to obtain the certification that they will need to provide this new service. So where we are with implementation, and this is kind of an ever-evolving process, as we've talked about, and right now they've identified about 5,600 people who are potentially eligible for the program. They received letters in the mail from the Department of Medicaid in, I believe, in May, and that program informed these folks that that a recovery manager will be contacting them to discuss accessing these new services. So the letter talks about accessing the new services and doesn't necessarily clearly indicate that they have to meet with this person if they want to maintain their Medicaid coverage. So we're really working with people to help them understand that this is a really important contact that they need to make with this recovery manager. The recovery managers who are currently, there are 3 entities contracted with the state to provide that service, and they are CareSource, CareStar, and the Council on Aging. Each individual has been auto-assigned to one of those 3 entities, and then a recovery manager is currently where they're working on reaching out to people who have been identified. The state has acknowledged that there are some data matching issues, and so we have been concerned for a while and are continuing to work with the Department of Medicaid to make sure that all individuals who have a mental health condition who are currently receiving services through a community mental health system are properly identified. So we are working with the provider system to help them get lists of the clients that they work with and identify as having Medicaid spend down that have a qualifying diagnosis to be referred to the program so that they also get a visit with a recovery manager to determine whether or not they are eligible. So if you're working with consumers who are connected to community behavioral health providers, or they have questions or want to know if they're eligible, I would encourage them to talk to their provider and ask questions. One of the things we learned earlier around the 5,600 people is out of that total, only about 2,000 were identified as currently having had a Medicaid service provided by a community mental health provider, and we know that number is really low. So we're working really diligently to try to make sure we've got all of the folks identified, and so that no one falls through the cracks and inadvertently loses access to their behavioral health services. And then finally, I wanted to just put up some resources. There are several places that you can find information. There is an SRS program webpage. There's an FAQ. There is an introductory video that might be helpful for consumers. And then the state has recently posted a recovery management handbook. So these are all good resources if you want additional information in writing relative to this program. With that, I will turn this over to Zach.
Okay, thank you, Teresa. I'm just going to spend a couple of minutes talking about how the elimination of Medicaid spend down will affect people currently on Medicaid ABD out in the community. As Jeannie already mentioned, there's a significant portion of people that are on the Medicaid spend down program now who will be transitioned over because they meet the new eligibility criteria. Here I've pulled out some information from a document that is posted on the Ohio Office of Health Transformation's website. As my last slide, I do have some references so that you can go right to those documents. But here we see that about 206,000 people are estimated to be transferred straight over to the ABD program under the new eligibility criteria, and then about 34,000 people who did meet their spend down in at least 1 month between August 1st and July the 30th, 2016. This is a significant number of people, and as the transition from CRIS-E to the new Ohio benefit system happens, it's possible that there could be conflicting information in the systems or that some people might fall out. And as a Navigator organization and many of the CACs that are available around the state, we're here to help those individuals understand what's happening with their Medicaid coverage and take any action necessary to make sure that they maintain coverage throughout this transition. As Jeannie mentioned, there's a group of people who is currently receiving SSI but not Medicaid who will be automatically put onto the program. And then there are those individuals who are on Medicaid spend down but have incomes below 138% of poverty who will be transitioned into the Group 8 category of Medicaid or Medicaid expansion. Then, as Jeannie mentioned, there is a significant group of people, over 18,000, who are expected to lose Medicaid coverage as of August the 1st. Those are people with income above 138% of poverty and no Medicare who have not met their Medicaid spend down in any 1 month between, any 1 month in the last year. Those people are going to lose coverage, lose access to minimum essential coverage. As many of you know, the Affordable Care Act has an individual mandate that says all people must have health coverage that meets a standard known as minimum essential coverage. People who were covered by the Medicaid spend down program, even if they had not spent down their Medicaid, were considered to have minimum essential coverage. Because they lose that coverage on August the 1st, they will be eligible for a special enrollment period to shop for insurance on the health insurance marketplace. And then depending on the income, they may be eligible for a tax credit to make that coverage more affordable. So what are the options for those 18,000 plus people that are losing coverage? They could go into employer-sponsored insurance if they do have an affordable option there. They could enroll in a marketplace exchange program with or without their financial assistance. They could shop for other private insurance, or we have to acknowledge that they could go without coverage. Here on the slide, I've just quoted from some guidance that came out from CMS in 2014 about the Medicaid ABD category spend down, and that in fact qualifying as minimum essential health coverage. If just in case someone were to end up in a situation where they were asked to prove that they did have minimum essential coverage and they've lost that coverage. So for people that lose their coverage, if they are able and willing to go on to the marketplace and look at their options themselves, they could go to healthcare.gov or call the Marketplace call center. If they would prefer to work with somebody who is knowledgeable about the process and can help explain what's happened and what's going to happen in the future, they can go to localhelp.healthcare.gov to find an organization like the Ohio Association of Food Banks, many of our federally qualified health centers, and other organizations that are offering in-person assistance on the marketplace. Here in Ohio, they can also go to the Get Covered connector, which can be found at rucoveredohio.org. That's an online scheduling tool. If you work with consumers, I'd encourage you to go to rucoveredohio.org, type in your zip code, and learn what organizations are providing services in your area. This would be a great time to reach out and form some partnerships with those individuals prior to August 1st. And then finally, people can call the Ohio Association of Food Banks Consumer Assistance Hotline at the number on the slide. Again, the slides will be shared with all of the attendees at the end of this webinar. So just a few ideas for organizations that are out there trying to find individuals who may lose coverage through this transition. We've suggested a few agencies to form partnerships with, including your County Department of Job and Family Service Office, area agencies on aging, any aging and disability resource networks that are active in the area, looking at payee services, or even partnering with local Social Security Administration offices. In addition, we've also talked with Medicaid about providing geographic breakdowns of the population that's expected to lose Medicaid, and we are still waiting on that information from Medicaid. And then we've also asked that information about navigators be included on Medicaid termination notices that will presumably go out to people losing Medicaid very soon. So I've included my contact information on the slides, as well as a list of references for where I pulled the information from for the presentation. But I think now we'd like to get to any questions that you'd all have. So I will turn it back over to Gail.
Thank you, Zach, and thank you to all of our presenters for all of the information that you've been able to relay. We have just a couple of minutes for questions, and so I am going to open up the line so that if you would like to, you can unmute and just introduce yourself and ask a question to any one of our presenters. Or if you'd like to add your question to the list in the chat log, you can add it down there. And once we do questions, we'll open it up for one final note on how to submit questions and wrap up the webinar.
All attendees are muted and may unmute themselves by pressing *6.
let's go ahead and jump right in with actually the final question from Jane Wagner on our list, which is, what is the time frame to be able to obtain coverage through the Affordable Care Act after people lose Medicaid access, if that happens?
Yeah, so they'll be able to start applying for the special enrollment period up to 60 days prior to the date that they'll lose coverage. So as soon as people are notified, they could go on the marketplace and start that application process. Generally, after a person, they would also have 60 days on the back end, so 60 days after they lose their minimum essential coverage to start applying for that SEP. After they're approved, they'll have 60 days to shop for plans, pick a plan, and enroll.
You can press star 6 if you'd like to unmute yourself, and you can announce your name and pass on your question.
Gail, I saw a question, can stable accounts be set up in lieu of qualified income trusts? Stable accounts are a new vehicle for people with disabilities to have a tax-free savings plan, and they can deposit money into this account, and the accounts are not considered in the Medicaid eligibility determination, and the money can be used for a broader array of things than a qualified income trust. It's my understanding folks on our coalition have posed that question to Medicaid, and we have not yet received a response, but that is something that we want to know as well, to make sure to address that.
Both Becky Hayward and Ruth Smith raised another question or note about the QITs, and that was that in some areas, especially rural areas, there aren't banks that are available or prepared to actually do QITs. Is that a concern that you all have heard or that you are aware has been expressed to the state at this time?
Absolutely. That was expressed when the idea was initially proposed, and we continue to express it. The state has indicated they have talked to some banks, and that automated health systems, it's their job to help a consumer find a bank that can hold the account. And I understand they are still having some challenges in the rural areas. But we have definitely conveyed that concern and continue to do so.
Another question that was raised by Raven Oglesby, she was asking about the specialized recovery services and where or who developed the eligibility criteria for that SRS program.
So the eligibility criteria for the SRS program was developed in part of it is generally developed by the state. However, they had no flexibility related to the requirements for conflict-free case management. So the requirement that there be an independent recovery manager was the approach that was taken, and the evaluation of where the person lives. Those are both federal requirements. All of the other requirements were defined by the state, and frankly, we have done a lot of advocacy to expand that eligibility requirement, particularly around the qualifying mental health diagnoses and the historical service utilization of mental health services. Initially, those requirements were much more restrictive than they are today.
And it's 1 o'clock, so let's just address one more. The question comes from Barbara Bennett, and that is, will consumers still need to meet their spend down in July 2016?
This is Jeannie, and yes, they will. If they want to get health coverage for July of 16, they will have to meet their spend down. And in some cases, it's probably more important than ever, because if they have not met their spend down at all this past year, they have one last chance in July to meet it, and that would carry them into the next year under full Medicaid coverage. So I would, if you have clients who are spend down clients, I would encourage them to meet their spend downs in July if at all possible.